Hello everyone, welcome to the new session in the series of medical education, that is Miller's Pyramid and some assessment terminology. Myself Dr. Tejinder Singh, I am MD in Community Medicine. Let's begin our session. Our specific learning objectives are to learn about the Miller's Pyramid and to know various assessment terminology while assessing the students. Our Miller's Pyramid, it proposes clinical competence at various levels and it is a useful way to build authenticity in assessment. It's a tool used for assessment that should be matched with the levels sought to be assessed. So there are basically four levels. That is, first is know, the student has a factual knowledge, knows how, that is concept building and understanding, shows how, that is competency to perform, and at last at top is does, it is he actually performs, that is performs in the practice. Now there are some assessment terminology. So first is test. So assessment to test knowledge could be paper or pencil or computer based. And what is a tool? It is assessment used to observe skills or behavior, example or ski. Formative assessment, the primary purpose is to provide feedback and it is generally not taken as pass or fail decision and is a part of ongoing teaching and learning process. Then there is a summative assessment, the assessment conducted at the end of a unit, semester or a course to check how much the student has learned and how well the teaching was. Then there is a fifth, that is criteria reference assessment, comparing the performance of student against a predetermined criteria generally used for certifying examination, and standards are established before the examination. Then there is a norm reference assessment. It compares the performance of student against one another, generally used for selection examination, and standards are established after the examination. Then there is a validity, degree to which inferences drawn from assessment data are supported by empirical evidence or theoretical rationale. Then is reliability. It is a degree of confidence that one can place in the assessment results measured by precision, consistency or reproducibility. Competency. It is an observed activity demonstrating habitual and consistent use of knowledge, skills, communication, clinical reasoning, emotions, values and reflection in daily practice. Then a student is a competent, is a one who possesses the required competencies. Competence, satisfactory level of knowledge and skill required to perform a professional task. Performance, that is assessment of what an individual does in actual life. Then there is an authentic assessment. It is making assessment task as close as possible to actual task that the student will perform in a real life. And then another terminology is integrated assessment. So assessing the multiple competencies within the same encounter, that is knowledge, skill, professionalism and communication can be tested by a single well-designed OSCE station. Then there is a checklist assessment, assessing by breaking the professional task into smaller components. And there is a global rating. It is a rating by the subject experts used mainly for complex clinical tasks such as decision making, professionalism or communication. Then at last are competency-based assessment. It is not only for certifying the competency but also helping in the attainment of the competencies. Therefore, it is longitudinal. It happens in authentic setting and is concerned with formative function and liberally uses developmental feedback to guide the learner. And at last there is programmatic assessment. It is program of assessment wherein information about the learner's competence and progress is continually collected, analyzed and acted upon. My references for this presentation are Principles of Medical Education, 5th edition by Dr. Tejinder Singh. Thank you everyone. Like, share and subscribe to my channel.